are a variety of emerging treatment options for MGD. These include obviously LipiFlow, a technique called intense pulse light therapy, and then various ways that you can try to heat the lids and extract with various different tools. Their common goal is to relieve obstruction of the meibomian gland. If a patient has MGD, they deserve to know. Whether or not you decide to treat might depend on a host of factors, which would include end-stage gland loss, the patient's ability to afford the procedure, their willingness to adhere to at-home therapy, and those types of variables. There are some patients who we decide not to treat. The breakthrough concept with LipiFlow is that it heats the inside surface of the lid. It's very, very difficult to get a gland to therapeutic temperature by accessing it through the outside of the lid. It was that realization plus the administration of simultaneous pulsation, which evacuates the gland, that really brought LipiFlow into being. The other advantage is that it completely protects the ocular surface while the treatment is being done. One of the best indicators that LipiFlow is working is that the patient comes back and asks me to do another one when it's time. So we know that there are many, many patients who are looking forward to having that treatment done a second time or maybe at an annual visit. In terms of follow-up for those patients, after LipiFlow, we always see them 4 to 6 weeks after treatment. We make sure that the glands are still open. We may need to do a quick expression of some glands, and we also reinforce our at-home therapy. In certain patients with more severe disease, we are also co-managing the ocular surface complications. And so while an uncomplicated patient may be seen again in 6 months, patients with ocular surface inflammation may be seen again in 3 months or 6 months, and then we really have to try to manage that aspect of the disease. We are very careful to educate our patients about why MGD occurs, and then I use my staff heavily to engage the patient with detailed but simple instructions that are written down about what they need to do at home. This would include blinking, this would include device avoidance for social use, this would include warm compress administration, lid margin. This would include warm compress therapy, lid margin hygiene, avoidance of computers, blinking exercises, and managing their contact lens use.